Hi there, my name is Eric Chang. I'm a Canadian respiratory therapist asking for your help to improve respiratory healthcare in Nepal. I first came here in 2006 and was blown away by the hospitality of the people. I'd be hiking in the mountains and lost there, and people would just welcome you in. But life was fairly different in the hospital, in which it's a resource limited setting. And along with that is also a need for medical education, especially in the respiratory field. Since then, I've actually had the privilege of walking medical residents through weaning and extubation of patients, and many of them their first patients, and hopefully their long careers. And what I bring to the table is that of a mediocre Canadian clinical RT. So I believe this is something that we can all be involved in. The Respiratory Nurse Certification Course is a 3-month program for already practicing clinical nurses with a critical care certification in there. But they're just looking for the next level of care that they can provide for their ICU adult patients. Here in Nepal, they make about 20 to 25,000 rupees a month, and so it becomes somewhat challenging to get good quality education um, for the nurses. And so that's why this program has been developed. So through collaboration with Respiratory Therapists Without Borders, who I represent, and Critical Care Nurse Association of Nepal, there is a new respiratory nurse certification course, this 3-month course, that was just approved actually earlier or last month, about a month ago. And we'll be starting our first batch of students next month. There's a program outline online, and I'd encourage all of you to kind of check that out if you could and provide some peer review, but also to consider whether or not you can do a lecture. The lecture now is quite simple. You just create something in Google Slides and you can record something just like this. And it would be super helpful to get the clinical insight of people that are actively on the ground right now providing respiratory care to train up the next generation of nurses here and to provide care excellence. So, how can we help? There's one of creating presentations. Basically, any faculty or educators can do this, or people that are experienced clinical RTs who feel comfortable doing presentations, that would be awesome. You can also share clinical experience. We're looking for 108 clinical scenarios to promote critical thinking and troubleshooting in different situations. If you've had a difficult case and you would like to share that, by all means, please write that out, and we would love to put that into a simulation at the bedside, or not at the bedside, at a simulated bedside here using your stories. So we appreciate that. And if you can come precept either for the labs or actually give a lecture somewhere between July 21st and August 31st, or we're going to be doing clinical rotations September 1st to October 12th. If this could be you, I'd greatly appreciate your presence here. And thank you again for your time and attention as RTWB improves respiratory health through educational advancement of local healthcare providers worldwide. Thank you.